segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
Welcome back to 2 News at Noon. We are talking heart health as February is Heart Month. And there is a rare heart disease that pregnant women and even postpartum women might not be aware of. Joined by Katrina Jensen with Intermountain Health. Thanks for being with us.
You're welcome. Thanks for having me, Jade.
So talk to us about this rare heart disease that pregnant and postpartum women should know about.
So peripartum cardiomyopathy is a rare disease, but the thing to remember is that during pregnancy, women have 50% more blood flow during pregnancy. So your heart is really working hard. And a lot of people don't realize that because you're growing a person in there. So there's a lot of stress on the heart, a lot of demand on the heart. And so it's important to be aware that there are some things that can happen to women during pregnancy.
And so what are some of the symptoms that women should be looking out for when it comes to this heart disease?
So, shortness of breath is one of the first ones. Swelling, which can happen normally during pregnancy. Fatigue, which also can happen during pregnancy, but just kind of more than you're normally used to. And then the one thing that's probably a little bit unusual is the cough, kind of a significant cough, because that is just a sign that doesn't usually happen when you're pregnant.
And what could possibly be some of the risk factors with this?
Well, multiple gestation, so people having twins or triplets, again, a lot of work on the heart, that the heart is having to pump that blood to grow 2 or 3 babies, et cetera. The more pregnancies you have, the more risk you have. Women that take tocolytics or things to prevent preterm labor can be at higher risk. Non-Caucasian women can be at higher risk. And women that have high blood pressure or other genetic factors can also be at risk. And these things, high blood pressure can also happen, of course, as we know, especially in first pregnancies.
And I think an important factor, too, is, us as women, we know our bodies the best. If we think there's something amiss, it's okay to just call our doctor and talk about what we may be feeling, because, like you said, some of these symptoms can coincide just with being pregnant anyways.
That's right. And just to stress the importance of prenatal care, those 13 visits, super important, because then your provider, your midwife, your doctor know what's going on with you. You're able to communicate. You have that good relationship and that trust. And that will help prevent a lot of problems down the road.
Absolutely. Those prenatal visits are so important. And just erring on the side of caution and making sure that we're keeping our bodies healthy, our babies healthy, and our hearts healthy.
Absolutely.
Thanks so much for being with us today, Katrina.